Golden 10 seconds of patient care. What are the golden 10 seconds of patient care? The golden 10 seconds of patient care is the first interaction between the patient and the physician. The patient will make a decision within the first 10 seconds if they like and trust their doctor based on body language and unspoken words. This small amount of time is critical as it determines the patient's perception of you as a physician or healthcare provider. This video is designed to tell us how the physician may be perceived by the patient early in the encounter and what the physician should do to improve the patient's perception. The patient may be watching how we as physicians present ourselves. Every relationship begins at first sight. How you appear to the patient when you enter the exam room is an important aspect of the patient's perception of you for the entire visit. During the encounter with the patient, you should only show the best side of you. Enter the patient's room with a big smile and introduce yourself. You should see the patient with joy and confidence. Show them that you are happy to see them and treat their problem. Don't appear frozen or nervous with the patient. Enter the patient's exam room with an open position. Be aware of your body language and avoid appearing to have a closed attitude with the patient. It's important to establish and maintain eye contact with the patient. The patient tends to probe the doctor's eyes looking for positive or negative mood signs. Maintaining eye contact will allow you and the patient to become closer during the visit, and it helps to remove any barriers with the patient. If you want your patient to remember your discussion, it is important to look at the patient when you are talking to them. Eye contact has a positive impact on memory retention and recall of information. The duration of eye contact should be long enough to notice the color of the patient's eyes. It's also important to shake the patient's hand. When you walk into the patient's exam room, offer a quality handshake to the patient. A standard firm grip handshake is appropriate for a professional introduction. The handshake should be neutral with the thumb on top of each hand. The handshake should result in a feeling of equality. It is easy to become distracted while seeing the patient. Give your undivided attention to the patient and talk to the patient face to face. Do not allow yourself to become distracted by things like your cell phone, writing, checking medical records on the computer, or x-rays when you are talking to the patient. It's always better that you study all the patient's information before you go into the room so you can give the patient your undivided attention. Pay attention to the position of your body. Regardless if you are standing or sitting, do not turn to the side or cross your arms. During your interaction with the patient, it is important to maintain a good posture. Make sure to broaden your shoulders and stand up straight when you enter the patient's room and during the entire duration of the encounter. Avoid exhibiting poor posture. Typical signs of poor posture include standing with the head forward, rounded shoulders, leaning backwards, and the knees bent. Do not stand with your hands placed firmly on your hips. Standing like this gives the patient an impression of dominance or defensive attitude. When talking to the patient, imagine that you are being watched by the patient. Focus on your body language and stand or sit confidently. Aim to have a neutral position with your arms, with the hands placed at your sides. Remember, your actions in front of the patient speaks louder than your words. Body language accounts for 55% of communication. Body language includes facial expressions, eye contact, posture and stance, space relationship, and gestures. Verbal communication accounts for only 7% of the communication, or the actual words that are said. How a person sounds accounts for 38% of communication. Pay extra attention to the inflection of your voice. Avoid changes in the pitch or tone of your voice. By keeping a calm tone of voice, this creates a calm, soothing environment for the patient. Paralinguistics is a type of vocal communication without the use of language. Paralinguistics includes voice inflection, pitch, rhythm, loudness, and tone. A slow rhythm with a hushed tone indicates gentleness and concern. A heavy pitch with rising inflection indicates anger or enthusiasm. Do not be too close to the patient during the visit, or this could create discomfort and annoyance. The personal distance between the doctor and the patient should be between 18 inches to 4 feet. If there is any closeness less than 18 inches between the doctor and the patient, the encounter could become too intimate or too close for the patient. Any distance more than 4 feet between the doctor and the patient is appropriate for social gatherings. However, it is not appropriate for clinic visits. Find ways to connect with the patient. Gestures toward the patient, such as giving the OK sign or a thumbs up, works to have a positive impact on the patient's perception of you as a physician. Simple gestures like handing the patient your card is an effective way to build patient satisfaction with you and end the visit on a positive note. Also make a point to tell the patient things like, "It was good to see you again," or "It was good talking to you." These types of statements will leave a positive, lasting impression.
This video is for educational purposes only. Please consult your doctor before you make any decision about your medical care.